Hello again, everybody. Happy Tuesday to you. Dr. Zom here with another episode of Tooth Teacher Tuesday. This week we're on to another episode of our Oral Pathology Corner. And this week's topic is another common dental finding, and it's what we call an oral papilloma. Now, the word papilloma might ring a bell to you because you might be thinking, and correctly so, you might be thinking of the human papillomavirus, or HPV, which is kind of the boogeyman, so to speak, because we talked a couple episodes back about how herpes is a very common virus that most of us have it in our system and don't ever even know it. And the same is true for HPV. It is important to mention that, like any other virus, whether it be herpes or the coronavirus or, in this case, HPV, there are many different strains and variants of the virus. And so the kind that gets kind of the bad rap is the HPV that you get the Gardasil or other vaccines for, and that's more concerning, like genital HPV. We're talking oral HPV, which there are, again, some variants that can cause throat and neck cancer. So it's certainly something to take somewhat seriously, but those strains are very rare and uncommon versus the HPV that we tend to see in dentistry, which is going to cause the little oral papillomas or warts, which look a little something like this. And so again, most of us have the virus in our system that would cause a little wart like that, very similar to the HPV wart that causes warts on your fingers or toes or other parts of the body. And so most of us are carriers, but most of us will never have the symptom of developing one of those warts or papillomas. And so, again, really not anything to worry about. I would say the biggest concern with them is that people find them annoying and want to get rid of them. And basically, the process is like other warts. You can freeze them off, but honestly, with something in the mouth, it's really just better to cut it off with a scalpel. But again, really nothing to worry about beyond that. Of course, as always, if you see some sort of unusual lump or bump in your mouth, don't just assume it's something like a papilloma that's benign. Have your dental health professional or some other medical professional evaluate that. Can never hurt to biopsy something just to make sure. So hope this was informative for you and you enjoyed another segment of Oral Pathology Corner. Next week we'll be jumping back into a topic that we started on a few weeks ago, which is fluoride. And so I hope you'll tune in for that. Until then, have a great week, and I hope to see you next Tuesday.